Welcome to the Pharmacy Podcast Show. You are listening to the first and only podcast dedicated to the business of pharmacy. You can find all of our episodes at pharmacypodcast.com.
Hello, everyone. Welcome to the Pharmacy Podcast. My name is Dr. Christina Tarantola, and I'm a one-woman show today. Adam will not be here, but I promise I have a bunch of goodies to share with you today. So what is the Fit Pharmacist? No, it's not a person, it's not me, and it's not Adam. It's really a movement. We want to empower other pharmacists to get involved with nutrition and exercise coaching for patients. So when we're operating at 100%, we can deliver the best care to our patients. Now, you don't have to be a pharmacist to listen to this podcast, although it is geared towards pharmacists. We have over 60,000 listeners who are mothers, spouses, other types of business people. We really strive to reach as many people as possible to spread the message of health. And I have a special guest today who's going to talk to us about health. So Vito Colombo is a fellow pharmacist, and I actually met him at the Italian Pharmacist Society when I was part of that in New York. He's such a genuine person. He's always looking to help out other people, and he's helping me out today by coming on the podcast and talking more about how pharmacists can become involved in health coaching. So Vito is an independent pharmacy owner, and he opened his pharmacy in Middle Village, Queens in 2002, right next to his family's fruit market, which has also been family owned since 1972. Wow. It's amazing. And I have to say, I met Vito and I was immediately drawn to how sincere and genuine he is. And I even looked on Yelp and looked under Colombo's Pharmacy, which is, the pharmacy that he owns. It really has amazing reviews. Some person said, sweetest and most genuine and sincere business owner you will ever meet. And I really couldn't agree more. So everybody, please give a warm welcome to my fellow pharmacist, my fellow Italian paisan, Mr. Vito Colombo.
Thank you, Christina. I appreciate being on this. And when you asked me to be on it, I felt that it was nice to help you reach out to people, and it's an honor because it's so important to you, and it becomes important to me to reach out and talk to people about what you're trying to do, and start this program together and continue what you're doing. So thank you for having me, and I will be happy to help you and give as much information as I can and what I know and what I do every day, the job that I love to do every day, believe it or not.
Oh, yeah. And you've been there for 15 years, right?
Yes, 15 years. We started September 2002, and we filled 0 prescriptions that day. And
wow.
Every day after that was 1, the next day 2 or 3, and it just, people kept coming, and people knew about us, and we're in the community. My store is 2 blocks away from where I grew up.
Mm-hmm.
And we've been in the community since 1970. And my father's and my family's fruit market is right next door. And that's been since 1970, also 1972. So we've been in the community, and we are community people. Family is here, although I've moved away, 10 miles away, but not far. I would have stayed here. But anyway, it is a beautiful community, and tight-knit, small, where people like to have information, and we can provide it.
Absolutely. And yeah, and I was even back in, when I was in pharmacy school, I remember coming to your store, and it's just, you treat your customers so well, and I can tell it's a real family feel, which, I'm familiar with from my dad's pharmacy, but it's really amazing to see all of your success and how well you treat your customers and your clients. So, and then just to, have the fruit market right next door. I mean, I met your brother when I was working there last year. So it's such a great thing that you're running. And that's why I really wanted to highlight, what you do and have you talk a little bit more about, what you've seen as far as, what pharmacy has grown into over the past, 15 years since you've been in business? Like, can you tell me more about that?
Well, yes, in the last 15 years it has changed. And it's funny, when I started in 2002, people have said, yeah, it's changed over the last 15 years prior. So it's changing. It is. The pharmacy, the healthcare industry is changing and evolving all the time. And for the good, and sometimes there are setbacks, but you need to take the setbacks to move forward. And we continue to move forward in providing, being there every day and providing care. So I guess the biggest thing is the reimbursements have changed, and there are different programs that they're trying to implement through the New York State Medicaid program. Like there's one called DSRIP, it's Delivery System Reform Incentive Program, where they're trying to do a value-based approach to helping people stay out of the hospital, stay healthy, and comply with medicine, and taking the medicine to being more in touch with the pharmacist and the doctor, and decrease the visits to the hospital and keep them adherent and compliant to their medicine. So things have changed from they're changing now from fee for service to value based, and that's with change, people don't like change all the time, but change has to happen to improve sometimes. So we welcome it and we try. And what you're doing is exactly along the same lines with Health Coach, where we are there every day on the bench, as we say, talking to the customers and being a big part of their lives, because we're easy access, informative, and we're able to help them at the point of service, point of sale. It's not, we're here. It's not like a lawyer or a doctor. We have to make an appointment, sit down for half an hour. It's different because we're so accessible, and being implementing something like this would help also in teaching them and talking.
Absolutely. And even, I know that you had mentioned you see a lot of patients that have diabetes in your pharmacy. So yeah, even having some kind of, program where patients can come in or, ask questions, or maybe have part of a class where they can come learn, how to better manage their diabetes. I mean, that's also part of, the prevention model and the health coaching model, where we're looking to provide quality to really have these patients, like you mentioned, be, adherent to their medications, understand their medications, and, just feel empowered to, be healthier. Because a lot of times what I find is that, I deeply respect doctors, but, something that I do find a lot is that whenever patients come into the pharmacy, they'll say, oh, my doctor prescribed me this medicine for diabetes, but he told me to lose 30 pounds. What do I do? So I think that the role that a pharmacist can play is to be the intermediary between, the doctor and the patient, helping the patient to understand, okay, what are some simple ways that, I can take control of my health by maybe moving a little bit more, or learning the My Plate method, which is, the half of the plate of vegetables, a quarter of it is the lean protein, and then the other quarter is the complex carbohydrate. So something even that simple can really give a patient the right information to move forward and to, create goals for them so that they can actually maybe, come off medication, or improve their energy, their quality of life. So yeah, you've seen a lot of that, right? Too, like diabetes, high blood pressure.
Yes, I agree. Exactly what you said. I have people coming in, and I think there is some disconnect when they leave the doctor's office because they get diagnosed, or they're pre-diabetic, or they're diagnosed, and the doctor wants to put them on something, and they're on something, and 6 months later, I still see them coming in. Nothing really has changed in the way they look. Sometimes people have gotten you could see that they're not losing weight. They're either higher or maintaining
Mhm.
the weight that you obviously they could lose or maintain a better diet. And I think it gets lost somewhere along the line between the doctor's office. They might give them literature, but not follow up
Yeah.
with if they're doing it, if they're going to the nutritionist that they might have recommended or might not have recommended. So, and that's where we do come in because we're right there at the end of the line, so to speak. Really not the end. I think maybe we're the beginning of something new, something else. So we are physically at the end, but we can contribute to our knowledge and getting more involved because they do trust their pharmacists. We are their community pharmacists, and there is a special rapport we have with our customers.
Right.
That way, there's a trust relationship, and we can form a good liaison between the doctor, us, the patient, and start getting more involved in coaching them and getting them healthier, and not per se. If they really do need the medicine, that's fine. But if they do everything right, they could use less medicine, more, as you said, healthier life, better atmosphere, attitude, and in general overall feeling.
Absolutely. Yeah, and definitely. So, yeah, I love what you said about, we're at the end of the line, but we're really starting something new. I truly believe that's where everything starts because the patient leaves, they have the choice, they have the autonomy and the self-will to take that medication or not take it. So being on their side, being a patient advocate, and having the pharmacist get more involved, we have been throughout the years with medication therapy management, which is great. It's a huge advancement in pharmacy. And in addition to that, I think that something that even, pharmacy schools can implement would be learning more about nutrition and exercise. Like, whenever I was taught about MTM, it was all about, 30 minutes of exercise, most days of the week. And, we didn't really get much information about nutrition on how to educate and empower patients to, go ahead and implement these things into their life. Nutrition and exercise is part of that MTM structure, but it was never a big focus. And I think that in the future, it really should be because that's how we can help patients come off medication, reduce their medications if necessary. Especially with insulin, whenever somebody loses weight, that's usually something that happens, they require less insulin. So that's just a simple example. But yeah, I think that, getting more involved, exactly what you said is what, pharmacists are going to be doing in the future. So as far as training, what are some ways that you think the pharmacist can get trained to learn more about coaching in general?
Maybe through, I would say through training. I mean, there are CEs that we take, and it could be CE programs done through companies that want to promote more nutrition and healthier lifestyle.
Yeah.
Also if the pharmacy schools have a program too that they could do for people that have graduated, for alumni, there could be something implemented there. And I can't think of anything else. Could you?
Yeah, I think you hit the two main points, continuing education, and also, that's one of our, ideal goals is to help pharmacists and pharmacy schools, learn more about how they can get involved with health coaching. So creating a program where, pharmacists can learn about these things. In addition, I know at St. John's, I learned about the motivational interviewing, which is all about the stages of change and using language to help patients understand and get motivated to want to reclaim their health in that way. So, even I know there's some courses on motivational interviewing, definitely continuing education, things like that. And there's a lot of opportunity with this coaching model. And I think that, especially where you are, with independent pharmacy, there's a lot of creativity and flexibility that can go into creating some kind of program, like I mentioned before, whether it's, a simple class, diabetes class once a week, or something a little bit more extensive. But there's definitely a lot of opportunity there.
Yes, it is. I say that we're always learning, and we're always learning, and it's good to learn something new every day. I learn from my customers every day.
Mm-hmm. Yeah.
They learn from me. So it's definitely, were you going to a diabetes class, were you saying, in teaching the customers about the diabetes? Or were you saying
absolutely. Yeah.
I wasn't sure what you...
Yeah, that's a good, thanks for asking that. Yeah.
I want to go back.
That's okay. Yeah, so just having classes for patients with diabetes, even understanding their medications, or talking about the role of insulin, or nutrition and exercise. And I know that that's a really key thing that we can have a role and play a part in.
Definitely, I think that's definitely important because again, and what gets me also, the education part for the patients, that most times people say it's the little white pill or the little green pill, but they don't even know the name of the medicine that they're on.
Yeah.
And that, I think, is right there the part that we should play a bigger role also. The patient should know the name and what it does and how it affects their body. So having these diabetic classes, disease state classes, high blood pressure. I had a conversation with a lady yesterday. We speak Italian here.
Yeah, I love that.
A lot of old Sicilian Italian people that live in the neighborhood, and they're endeared to us because we speak the language. And I was explaining to a lady, she said, I was getting something for my heart. And I said, well, this is a water pill. This is indirectly for your heart. And she goes, what do you mean? This is not for my heart. And I explained to her how the veins are pipes. And when you have a lot of water in a pipe, that's pressure.
Yeah.
That's pressure on the heart. And I said, when there's less water in the pipe, pipe meaning there's less pressure on the body and the heart. So she understood that. She did. Her and her husband stood there, and it just happened yesterday afternoon. And it's funny that just a minute of just taking a moment to explain something helped them understand how this drug helped her heart and helped her body because of the less water volume that you have. So it was a simple lesson, and she understood. And,
how do you say that in Italian?
You don't want to know because it'll be all Sicilian and Italian. I mix it up.
Oh, okay.
It's like a salad. But,
keep it interesting.
It's pretty good. Yes, it's great. It's great when you see the patient
get it.
Face light up and say, "Oh, okay, now I understand."
Yeah.
So it's very interesting, and we could do a lot. We could do a lot just talking to them and taking them for a few minutes to talk to them.
Absolutely. And your story reminded me of something my dad would do. He used to, he would laugh when he hears this, but he used to actually draw things out to show people, like, similar to what you did, like a pipe or something for high blood pressure or whatever it was. And I always thought that was so cool because people will remember that. And it's something they can relate to. They can't relate to hydrochlorothiazide. They don't know that word, but when you put it in those terms, it really helps somebody understand. So I love that you even, you told that story and that you told it in, you spoke to the patient in Italian. I think that's so cool.
Yeah, it's great. It is. And that's what we're here for. And,
yeah.
It's definitely enlightening and rewarding. I love it. It was a great moment. And, that's why they come here. They don't even live in Middle Village. They live in Glendale, which is next to Middle Village, but they come to my store because they feel comfortable there, and we make them feel comfortable.
You're awesome, Vito. Thank you so much for your time. And I'm going to put a link to, where people can connect with you if they have any questions. I'll put that in our show notes. And if you have do you have any other questions or comments that you wanted to let people know about?
Right now, it's funny that you're saying this because right now, as you're talking, my father walked in the back room, and that's where it all started with my father and in the food store. So he just happened to walk in this second, and it's so funny. But that's where we started in the food store. He said to me, "Get an education and do something." And I became a pharmacist, and like he did retail, keeping people healthy in the food store. I'm a pharmacist, and I try to keep people healthy-minded with health coaching now, and also with helping them with their medicines and try to keep quality of life and a good life for a long time. And it's funny that that's the way it just ended. It's great. It's a nice and any questions please be free to answer them. I'll go online and answer them.
Awesome.
And I appreciate you having me. I really meant a lot, and I hope people could grasp this and take it and go forward with it.
Oh, thank you so much, Vito.
Thank you.
All right.
You're welcome.
We hope you enjoyed another episode of the Pharmacy Podcast Show. Be sure to subscribe to the show and send us a voice message with your ideas and comments from our contact section on the website. Did you know we develop digital health content to assist with business development and marketing efforts? Learn how we can help you drive more patients, physicians, and targeted leads to your website. Contact us today at pharmacypodcast.com.